were a number of cultures by heritage and tradition that simply lacked any cardiovascular disease. They were plant-based. And so with that information, I came back to Cleveland, and when my wife and I decided to go on this plant-based diet for a year, and then I asked cardiology if I could have about 24 patients, which was the number that I could handle, and still carry out my surgical obligations. And the 24 patients that I received were, as my late brother-in-law used to say, the walking dead. But they were most cooperative, and it was within about, say, 15 months of starting this program that we had something striking develop. I was treating a 52-year-old gentleman who, in addition to his heart disease, had a partially blocked artery in his right thigh. And he told me about the fact that when he was crossing the Skyway to my office, he had to stop 5 times because of pain in his calf, because of this blocked artery. So I had him go to the vascular lab, and we got his pulse volume. And then I forgot all about his leg, so focused on his heart. And 8 months later, he said, "Dr. Esselstyn, do you recall when I first started seeing you, I had to stop 5 times crossing the Skyway to your office. This last month, it got to be 4 times, then it was 3, 2, 1. He said, "I don't stop anymore. The pain is gone." Don, back you go to the vascular lab. I think if you look here, you can see the difference in pulse volume when I first saw him. And here we were 8 months later. It was now almost 2 times greater. So the thing that was so exciting about this was, in science, we had demonstrated what we call proof of concept. Not only that, but this occurred 1 year before the invention of the statin drugs. So this was so powerful because it showed us that indeed with nutrition, we could actually not only halt this disease, we could reverse it. And not shortly thereafter, what occurred, we saw this now in the heart. This is a 54-year-old security guard where our angiography core laboratory described this as a 30% improvement.